Hey guys, Adam Gill here. Today I want to give you some information on a couple of Medicare supplement plans that I do recommend when I'm looking at Medicare supplements. A couple things real quick on Medicare supplements and how they work. I've got another video that explains this, but a quick review. With Medicare supplements, if you once you have Part A and your Part B, Medicare Part A and Part B is going to pay 80% of your medical cost. You're going to pay the other 20%. Okay. The Medicare supplement plan will pay that 20% for you for any kind of cover procedure for Medicare. Okay. So there's a couple different plans within Medicare supplements. There's only two that I recommend. There's Plan G and Plan N, and I'm going to go over those in detail today. You'll see some other letters as well, but Plan G and Plan N, in my opinion, are the only ones to even consider. Now, there used to be Plan F, which you'll probably hear of. As of January 1st, 2020, Plan F is no longer going to be available to people that are new to Medicare. If you already had Medicare previously, you're grandfathered in, so you can still keep it. Just keep an eye on your pricing if you do have Plan F or if you know someone that does. But so you can't get it if you're new to Medicare. So Plan G and Plan N are going to be my recommendations when it comes to Medicare supplements. Also, keep in mind when it comes to Medicare supplements, it doesn't matter what company you're with. Plan G right here on this page, Plan G with company A, B, C, and D, exact same plan. The only difference is the price. So you want to make sure that you're with a very solid company and you're getting a good pricing. So make sure your agent, whoever you're speaking with, is shopping it around and make sure you're getting a competitive price. Okay. So we'll start with Plan G here. Now, the way this works, you'll see the right column. That's really the one that you want to worry about. That's the one that you're responsible for. Okay, so that's really one. So this talks about hospitalization, nursing facilities, blood work, hospice care. You see all the zeros. You're responsible for nothing at all. When you see all cost here, that's just beyond an additional 365 days in the hospital. So if you're in the hospital for 90 days, you have a 60 lifetime reserve days. Once those reserve days are used, you have an additional 365 days in the hospital. So obviously a lot of time in the hospital they're going to be covered. And then that's when you will be responsible for it. But you're going to pay really nothing at all for the hospital. A nursing facility, they give you Medicare coverage 100 days in a nursing facility. After that, we're responsible to you. That's the same on all the plans. Okay. You see blood work, hospice care. So nothing at all on Plan G. The next page here. This is in or out of the hospital and outpatient hospital treatment, such as physician services, inpatient, outpatient medical and surgical services, supplies, physicals. So pretty much anything to do with the doctor office, any kind of treatment you're getting. You have a $198 deductible, okay? Once you meet that deductible, this is the Part B deductible. Once you meet that deductible, you're done paying for the rest of the year. And that's what it says right here. Once you have been billed $198 of Medicare approved amounts, your covered services, your Part B deductible will have been met for the calendar year. So once you pay $198 deductible, you're done paying. You go to the doctor for the first time throughout the year, that was $200. You pay $198. From that point going forward, anytime you have a procedure done, you're not going to get a single bill. Okay, so pretty amazing. That's the blood work. You're talking about lab work, home health care. So $198. So an example, you could have a $100,000 outpatient surgery. You can pay $198. You're done paying. Simple as that. Okay, so pretty powerful, pretty amazing plan as far as that goes. You can go to any doctor in the country that takes Medicare. So this really works out really, really well. Once you meet the $198 deductible, you'll never get a bill again for the rest of the year for any kind of Medicare approved services. Again, all the zeros. So it works out pretty good. Now let's go down to Plan N. And again, I'm going to show you why here in a second. You see some different letters, Plan L, Plan K. Again, there are different plans out there, but the Plan G and the Plan N are the ones you want to look at. Plan N, same page, hospitalization, nursing facilities. Everything's the exact same for what you're responsible for. Okay. So no differences so far. On Plan N, you still have the same $198 deductible. No differences there. The differences come into play when you go to the doctor. So once you meet the $198 Part B deductible, okay, you then have up to a $20 copay at the doctor office. So what that means, it could be $10, it could be $15, it could be $20. It can never be more than $20 at the doctor office when you go see a doctor. If you go to the emergency room, it's a $50 copay. If you're admitted to the hospital, that copay is waived. Okay. So you have a copay to the doctor after the deductible and the potential to the ER if you're not admitted. Okay. Those are the main differences between Plan G and Plan N. One thing you want to look at too is the Part B excess charges. It says you're responsible for all cost. Now, what we need to do is we need to understand what Part B excess charges really is. What that means, when someone goes to the doctor, the doctor accepts Medicare. They accept what's called Medicare assignment, which means that's how much Medicare will pay for that particular procedure that's being done. Okay. 95% of doctors in the U.S. accept what's called Medicare assignment. Okay. So it's going to be very difficult to find someone that doesn't take Medicare assignment. Could it happen? Yes, it could. Most likely, it's not going to. It hasn't happened in my career. I've got people in my office that have been here longer than I have that we just haven't ran into it before. Could it happen? Yes, it could. Be very difficult to. But what that means, let's say you find a doctor that does not accept Medicare or Medicare assignment. What that means is they can charge more than what Medicare says that is allowable for that procedure. Now, what happens is that doctor can only charge you 15% higher than what Medicare says they can charge for that particular procedure. So they can't just price gouge you and give you some astronomical number. They can only charge you 15% higher than what Medicare says they can charge you. Okay. So it's not something that they can just get outrageous with. But again, it's going to be very difficult to find a doctor that doesn't accept Medicare assignment. Okay. But that's what Part B excess charges really means. So someone might ask, why would I recommend Plan N over Plan G? Well, pricing, first of all, Plan G is more expensive than Plan N. Secondly, these prices are going to increase in cost on an annual basis, typically, depending on the percentage increase the company takes. So the Plan N is going to start here, okay? Plan G is going to start here, and they're both going to go up. In my opinion, you might as well start here instead of starting here when the plans are almost identical, okay? Now, Plan G also goes up at a lot faster rate than Plan N does, and that's over historical numbers. Plan N increases at a lower percentage rate than Plan G does. So your plans are going to go up at a slower rate than Plan G will. Secondly, if someone's really healthy and you don't go to the doctor a lot, let's say you go to the doctor a couple times a year, I would hate to see you paying for Plan G when Plan N can be saving you anywhere from $20-$30 a month up to $80 a month, depending on where you live. Depending on where you live at is a big factor. Now, if it's a couple bucks, that's one thing. But we can see some pretty big savings between Plan G and Plan N. And when we see those savings, Plan N can really save you a lot of money. Now, if you're going to the doctor a lot, once, twice a month, we're probably going to want to look at Plan G. So, but if you're healthy, not going to the doctor a ton, Plan N definitely saves you money, and the rates go up at a slower percentage than Plan G does typically on a historical basis. So, but those are the two plans that I would recommend when it comes to Medicare. If you have more questions about it, let me know. We can definitely get into some details about it. I'd be more than happy to give you more information. Hope this video helps, and hope you have a great day.